So what does design have to do with it? Well, I think everything, because in fact we all design. What I want to do in this talk is reframe design for you to show its value in healthcare. But I'm going to first talk about 3 stories that as a designer I have with healthcare professionals. And the first story usually goes like this. We need more art on the wall. And I agree, we do need more art on the wall. And this is a very loud, very long. And I do agree, we do need more art on the wall. But I'm not a fine artist, I'm a designer. But I never hear it framed as this. We need more art because of the healing process of art in providing, alleviating pain and suffering in the patients and the people that work there. The second conversation goes like this. We need to liven up our hallways. And I agree, and usually they mean painting it, but I'm not an interior designer, I'm an industrial designer. But I never hear it like this. We need to design a healing experience in the environments of our hospitals. Here's the third conversation. Glenn, we have a product. Can you make it sexy? Can you make it look good? And I probably can, but that's not the issue healthcare is having. Healthcare is not about designing products, it's a design service problem. Because healthcare is a service. And I was hired when I went with Mayo Clinic as a service designer. And this is how they're defining healthcare and the value of design. It's about design thinking. It's about a creative problem-solving approach. And I want to talk about that. And so what is design thinking? Well, effectively, it is using the tools of designers, such as prototyping, such as ethnographic research, by combining the people-centered approach, a human-centered approach, the viability of the organization, and technology to innovate. And that's essentially design thinking and the tool sets that designers bring in. So at the Mayo Clinic, they've actually created an innovation center where they're combining doctors, they're bringing in designers and administrators to take a design thinking approach, because that's how they think they're going to innovate healthcare, and solve the problems that they have from the service perspective. So, for example, they looked at their outpatient room, and they found that 90% of the interaction with the doctor is a conversation, and only 10% is in the exam room. So they actually redesigned one exam room and had 2 conversation rooms, because that's where healthcare is happening. And this is a little bit of the equation that they're using and why they see design as a fit. Because healthcare is patient-centered, design, we call it user-centered, and what they want is a human-centered solutions to the problem of healthcare. And I think that is where the value of designers come in. And this is essentially what a design process looks like. You empathize, you define, you ideate, prototype, and test. For the next few slides, I'm going to talk about some of my research around the empathy issue and about the user-centered perspective and research that I've taken over the years. So a few years ago, I worked for a company in the States called Herman Miller, and actually went into hospitals. And I identified all of the, you can call them workarounds, I call them creative solutions, people within hospitals, and I bet you'll find it here, are doing. The company valued it because they wanted to find out, innovate their line for their hospitals. The year later, I actually went with the Mayo Clinic, I went into seniors' homes and found all the creative ways that they were adapting their environments. The Mayo Clinic was interested in this because it showed them all of these creative ways people are solving a lot of its healthcare problems. And the great thing about empathy is that when you do it from a user-centered perspective, you get lots of solutions. And I also develop empathy tools for my students and myself to try to understand. Yes, you have to talk to people, but sometimes how do you empathize in other ways? Interestingly, this tool now talks, I do a lot of workshops on ageism because it brings up a lot of ageist attitudes when I both wear it. But so there's some of the tools that designers do because we can prototype things. It's helped me reframe how I design. For example, in this case, empathize, well, I talk to people that are managing their medication. They help define the issues for me. Then I brainstorm a number of solutions. We build stuff. Then you test it. And then you bring it back to the people and get it refined. And this has helped refocus about how I design. So instead of designing medical products for a commode, I now design human-centered products. And they look quite different because you're approaching it quite differently about what is the value to people in products and what they want. Here's a product I never thought I would do. And people indicated they needed this, a self-wipe aide. So on one side, you've got someone designing it for function, but what they wanted is a product that was designed for dignity, because that was the issue that they were designing for. And so what design thinking does and what it does for me, it helps refocus what you're really designing for. And as I teach my students, I'm really pushing that idea of it's a human-centered approach in design. It's a collaborative approach. Talk to people and design around it. So I'm going to talk to, there's a few clients we've worked with. I'll talk to some of the things we do and show what design at NSCAD in is 2015. So we worked with the Victoria Order of Nurses, and we looked at their Vial of Life program. And some of the things we use is systems mapping to help them understand it. We will then storyboard out that experience for them, and then story about a preferred experience for them. And that helps them understand their system and about it. So that's one of them. A couple of years ago, we actually worked with probably some people here. We went into the Capital Health, the hospitals, and we actually identified how you collaborate. And we created a taxonomy of collaboration, because we know that's the value of how healthcare innovation happens, within your own hospitals. So ultimately, what I would like to do is at the end of the day, I want to put 2 new ingredients in the healthcare fridge in Nova Scotia. I want to put designers as one of the ingredients at the table, and I also want to put design thinking as a methodology that all of us can use to help innovate healthcare. Thank you.